While in 2020, Africa was spared much of the worst of COVID-19, with relatively fewer infections and cases and deaths compared to other regions of the world, we start a new year facing new threats from the virus. With an average daily new case count of more than 25,000 in the last 14 days, Africa is experiencing a second wave, which is higher than the peak experienced last July. Preliminary analysis finds the new variant circulating in South Africa to be more transmissible, and it appears to be driving the surge in new infections in the country and in the sub-region. Genomic sequencing has found the 501Y.V2 variant present in 3 other countries, Botswana, the Gambia, and Zambia. And frankly, we think that it could be present in more countries than that. Deeper investigations are underway to fully understand the epidemiological implications, but at present, there are no indications the new variant increases the severity of disease. There is also no conclusive evidence that it will lessen the effectiveness of COVID-19 vaccines. While we continue to increase our knowledge of COVID-19, we do know how to stop the new and the old variants of the virus. We must persist with the proven public health measures that helped to slow down the spread of the virus during the first wave, including masks and physical distancing. Finally, a top priority is ensuring Africans access COVID-19 vaccines. It's unfortunate that so far vaccine distribution has been inequitable, but this is a massive undertaking and it takes time. The COVAX facility, which is coordinated by Gavi, WHO, and CEPI, aims to provide around 600 million doses for Africa, we estimate, in 2021. We expect the first doses to arrive by the end of March, with a larger rollout by June. However, COVAX can only cover 20% of the African population, so it is really wonderful to see the African Union's efforts to secure a provisional 270 million doses by the end of 2021 are achieving success. Together, we'll deliver nearly 900 million doses for this year. I think the aim is to minimize, to the extent possible, countries being left behind, because the principle around the COVAX is very much around equity. So I'm not able to tell you which will be the first countries, but the aim is to make sure that we have a kind of equal, to the extent possible, based partly on country readiness, which is why I was emphasizing its importance. So our aim is to make sure that all countries start to receive some of the vaccines that they need at the same time, so that countries are not left behind. And therefore, we emphasize very much the importance of getting on with the preparedness, making sure that countries invest all the effort that's needed for that. Clearly, South Africa is a country with a special situation on the African continent. It's the worst affected country right now. If we look at the current situation, in terms of new cases, about 75% of the new cases that are being reported. So it would clearly be among the first countries to receive the vaccine. What we want to avoid in an effort to address this equity is vaccines sitting unutilized while countries are getting ready. So again, just to emphasize the hard work that's needed in the next period in terms of gearing up the preparedness of countries.